Hi there, welcome to Colour Fit Chat number 6. This week I'm absolutely delighted to say I've got Chanel Williams on the show. Chanel is a certified nutritionist who's got a master's in nutrition from Liverpool John Moores. She's only young, but she's already got a CV to die for. She did her internship with the amazing team down at Sports Wales, and through them worked with the likes of the women's rugby team and football teams. She's now providing her own consultancy work, and already she's working with the likes of Cardiff City and Swansea City football teams, in addition to working for pro athlete supplementation. Chanel does an absolutely fantastic job and a really important topic on how we can best support the female athlete. Issues such as performance considerations around the menstrual cycle, issues such as REDs, again, increased prevalence at the moment. And I generally feel that women's sport is on the up and it's being better supported. But I want to also use the chat to champion female practitioners more, because generally they're vastly underrepresented in the performance world. But nutrition certainly is an area where I know there's a number of amazing female practitioners out there. So I would absolutely love for you to get involved and leave your opinion. So I hope you enjoy the show. As ever, use the hashtag ColourFitChat if you want to ask questions or leave your opinion. Enjoy the show.
First question is key areas to consider when working with female athletes. So a major concern is inadequate energy intakes. This can be either intentional. Athletes may be conscious of how they look or their body weight. They may be in a sport that values how they look. It may be a case of them competing in a weight category, or athletes may be wanting to improve their weight to power ratio, or it may be unintentional and the athletes may be underfueling for their training load and not really realising how much they need to eat to support that. Energy intakes are really important because we need enough energy to support normal healthy functioning after the energy demands of exercise have been met. Low energy availability is more common in female than male athletes, and underfueling can lead to symptoms of the female athlete triad like osteoporosis, amenorrhea and disordered eating. The triad is now recognised as part of a syndrome called RED-S, or relative energy deficiency in sport. And RED-S shows that low energy availability can impact pretty much all of the bodily systems, so from poor immune health to bone function and increasing our injury risk, and can have serious long-term effects. Underfueling can also lead to insufficient intakes of key vitamins and minerals such as calcium and iron, and macronutrients such as carbs and protein, which we obviously need for growth and repair and to fuel our exercise and replenish our glycogen stores as well. So it's really important for both health and performance. A key sign of low energy availability in female athletes is menstrual cycle irregularities. So it's really important that female athletes track their cycle, and if there is an irregular cycle or if perhaps periods have stopped altogether, then it's really important that they seek support from their coach and they're not embarrassed about this. It's really important to know that taking hormonal contraception can actually mask the symptoms of low energy availability, because this produces withdrawal bleeds which result from medication rather than healthy hormones. If cycles are abnormal, we need to increase energy availability by either increasing energy intake or decreasing energy expenditure. From a nutritional perspective, things like calcium and vitamin D supplementation may also be needed to support bone health, but obviously talk to a qualified nutritionist, your doctor and your coaches before doing so. Question 2 is how can we support the menstrual cycle with nutrition? So one of the most obvious things is iron intake. Women's RDA of iron is almost double that of men's. Obviously this is to compensate for menstrual losses. So it's really important to make sure we are eating plenty of iron regularly through our meals. So things like red meats are a really good source of iron. If you are vegetarian or vegan, then it's really important that you look for rich plant sources of iron like tofu and things like that. You may need to consider eating fortified foods or perhaps even batch tested supplements as well. If we are not eating enough iron, then this can lead to issues like anemia, it can lead to poor immune function, and it can lead to performance effects such as decreased VO2 max and early fatigue as well. One thing that might not be so obvious is body temperature increases the week before your period. So this is during phase 3 of the menstrual cycle, and this is due to elevated progesterone levels. So you might find that during the week before your period you sweat more during training, or if you're exerting yourself during the day or even overnight. It's really important that you're on top of your hydration at this time, and you may need to make sure you're adding electrolytes to your drinks during training or following training as well. Another common symptom during or leading up to your time of the month is sleep disturbances, and this may be due to hormonal fluctuations and also similarly changes in body temperature. So things like melatonin and ZMA might help with this. Obviously, again, make sure it's batch tested and if possible Inform Sport registered. And lastly, a more obvious symptom is increased appetite and cravings. This is due to, again, hormonal fluctuations and due to changes in insulin sensitivity. So these usually occur again the week leading up to and the week of your period. So to combat this, you should include portions of complex carbs in all of your meals. So these are higher in fibre and will keep you fuller for longer, as well as a source of protein and some fruit or veg. This will keep your blood sugar levels more stable, keep you feeling fuller for longer. What you shouldn't do is use your time of the month as an excuse to just binge, because although these junk foods are fine in moderation, they're actually high in saturated fats, which could actually cause inflammation and worsen some PMS symptoms such as cramping and things like that. Question 3 is about female athletes and ACL injuries. So why are we more susceptible, and what can be done to prevent and treat these injuries? So female athletes are 4 to 6 times more likely to sustain an ACL injury than a male athlete, and this is thought to be due to a number of factors, including neuromuscular, hormonal and anatomical factors. So naturally, women are more quadricep dominant than men, and studies have shown that spending time activating the posterior chain and having a structured training program to strengthen this area can reduce ACL injury risk. Studies have also shown that increased estrogen levels are associated with increased joint laxity. So we are naturally at higher risk of ACL injuries, so it's even more important to strengthen these areas. And then from a nutritional standpoint, studies have shown that consuming either collagen or gelatin and vitamin C, 15 grams of gelatin, 30 minutes to 1 hour before exercise can actually improve collagen synthesis rates. And it's thought that this may decrease injury risk or may help to repair ACL injuries and soft tissue injuries faster. Question 4 is how can practitioners identify or prevent RED-S? Early detection is really important because the symptoms can be quite subtle and the long-term effects can be very serious, such as osteoporosis, for example. So in order to prevent RED-S, I think it's really important that we educate our athletes and coaching staff on the potential performance and health effects, and coaching staff also need to know key signs and symptoms to look out for. It's also really important that we regularly screen our athletes from a medical and nutritional perspective, and they get asked about their menstrual cycles. The LEAF questionnaires can be used in that process, and it's also important that athletes are in an environment where they feel comfortable enough to discuss menstrual cycles with the coaching staff. So some key signs and symptoms, there are many, could be disordered eating habits, bone injuries and stress fractures, irregular cycles, or maybe their periods have stopped altogether. Fatigue and poor performance could be an indicator of underfueling, for example, a lack of growth and development. Also, it's important to note that this can affect athletes of any size, not just really lean athletes. The research suggests that athletes consuming under 45 calories per kilogram of fat-free mass are at risk of endocrine dysfunction due to low energy availability. So it's not just really lean athletes that can be affected by this. In terms of treatment for RED-S, a diagnosis is a process of elimination, essentially. So it's really important that we look at menstrual function and the symptoms mentioned. Also, there are hormonal markers you would want to look at, and you would also really want to do a DEXA scan to look at bone mineral density. So a multidisciplinary approach is needed. So you would like the doctor, the S&C, sports nutritionist or dietitian, and potentially a psychologist as well. If the low energy availability is unintentional, then it may be a case of just educating the athlete on how much they need to eat to fuel their training load and implementing a nutrition strategy to achieve that, and that may rectify the problem. However, if the low energy availability is intentional because it's driven by disordered eating or an eating disorder, then it's more complicated because the driver of the low energy availability is the eating disorder, and this needs to be assessed in order to rectify the low energy availability and the symptoms of RED-S. It's also really important that athletes don't just start taking the oral contraceptive pill in order to regain their periods, because this can mask symptoms of low energy availability and can just induce a withdrawal bleed. It's not the same as a normal healthy period. We should also consider the environment the athletes are in as well. So how can we educate the families on what RED-S is so they can better support the athlete when they are not with us?
Huge thanks goes out to Chanel there for a fantastic chat. She's actually stepped up to the plate last minute, which makes the job she's done even more amazing. Issues around the menstrual cycle are critically important for us to consider, and Dawn Scott has also done some really good work on this with the US women's football team, and you can catch that on Training Ground Guru. It's ridiculous in this day and age that it's even a remotely taboo subject, but thankfully attitudes are changing. RED-S is also seems to be becoming increasingly prevalent, not just in women, but also men. So it's vastly important that we're educated in this subject and we have the tools to help people out. So I hope you enjoyed the show. If you've got any comments or questions to leave the hashtag ColourFitChat. Next week, we have nutritionist Matt Jones on the show, and he's going to be talking about the intricacies of nutrition. So hopefully I'll see you then.